Thank you for giving me this opportunity to talk about functional medicine. You know, I'm not a very seasoned speaker, and I agreed to do this because I feel like that functional medicine has something really significant to offer our field and our patients. So I hope that I can convince you of that by the end of this talk. And I'm trying to move the slides and can't. There we go. We just skipped over. I have nothing to declare, no special interest. And first I wanted to start by asking the question, you know, why do we even want to contemplate a new way of looking at chronic diseases? Well, I think most of us really know that we're not doing a very good job at getting people well from chronic diseases, and the prevalence is increasing, not only of individual diseases, but of each patient with multiple chronic diseases at the same time. And this means that we are all living an increased proportion of years with disability due to chronic diseases. And of course, this leads to subsequent increased costs to society and to the individual, and an increased burden of complex patients in our primary care practices. So what is functional medicine? Well, this is the definition in the website. It is an individualized, patient-centered, science-based approach that empowers patients and practitioners to work together to address the underlying causes of disease and promote optimal wellness. It requires a detailed understanding of each patient's genetic, biochemical, and lifestyle factors, and leverages that data to direct personalized treatment plans that lead to improved patient outcomes. Well, to me, that sounds like what we all strive for. It's an idealized version of what we want. And it doesn't really give you an idea of what functional medicine is exactly. To me, it's a new way of thinking about chronic diseases, and it's based on systems biology. So let me just define what systems biology is. It's an in-depth investigation of individual biological components at a systems level to understand how a process, a cell, a group of cells, or an organisms work as a whole. This will help in understanding the interrelationships of the different components of a process, how they interact, how they influence and regulate each other. And so what this tells you is that it really is about the connection of the way the individual parts of a system relate to each other and influence each other. So it's less of a linear way of thinking and more of a web-like thinking. So one analogy that is used commonly in the functional medicine field is that of a tree. And it's a great visual because you look at the branches, and in our current model of looking at diseases and diagnoses, you're basically talking about a branch. You know, you could have pulmonary medicine and cardiovascular disease and urology as different branches, or you could have depression and cardiovascular disease and different branches. It's all in the periphery, in the outside. But functional medicine stresses the fact that they're all interconnected at the trunk, and that at its roots, there's common underlying physiologic factors that produce these outer manifestations that we call disease. Another good image to keep in mind is that of a web. And if you look at the red circles, they're like nodes on a web. And the illustration just brings out the idea that they're interconnected. And if you try to pull one or affect one, that you will be affecting the others as well. And that if you want to move one in a certain direction, you will probably distort the whole web unless you're thinking about the whole web as you move them. And the last image I wanted to offer is that of a mobile, because it highlights the idea of dynamic equilibrium between different parts. So if you have one that's out of balance, the others compensate in return. So keep these in mind. I mean, these all kind of give you an idea of what functional medicine might be, but it really doesn't illustrate what it actually is or how it functions. So what I want to do, what I want to spend the rest of this time doing is just going through a patient example and taking you down the path as we normally would, and then seeing where we diverge into more of a functional medicine way of thinking. So this was a 31-year-old male with fatigue for 2 years. And he felt tired all the time, slept 8 to 10 hours and still awakened unrefreshed. He had a desk job that wasn't particularly stressful, but it was having difficulty concentrating and being efficient. He used to surf and exercise more, and now he's too exhausted. His partner complains because he tires easily and is straining their relationship. Previous labs had been normal. So in review of systems, he did have some additional complaints. He had frequent headaches, there were tension type, and he just managed with over-the-counter medication. He had chronic sinus congestion with frequent sinus infections. Since age 12, he had been to see ENT because of multiple courses of antibiotics, and a CT scan had shown thickened sinus membranes, but no other abnormalities. Allergy testing had been negative, and he had been treated with nasal steroids, which led to epistaxis. So he was just treating the infections as they came up. And he had dysuria with which was intermittent but frequent, with many negative urine cultures, had multiple courses of antibiotics, with no improvement, and even urology evaluation with cystoscopy that hadn't shown any relevant findings. And he had digestive complaints, which were basically IBS. He had tried to avoid wheat and felt that it helped somewhat, but not completely, and currently was just using some fiber. His past medical history, he was term birth, born by a repeat C-section. He was breast and bottle fed for 6 months, had infant colic, frequent ear infections, recurrent tonsillitis with a tonsillectomy at age 7, parent separation and divorce, drug and alcohol abuse for quite a while there, 8 years, and a family history that really was non-contributory. Currently, he used no substances, had been really clean, except for a cup of coffee in the morning, had an omnivorous diet, mostly whole foods and lots of veggies, and wheat-free. He exercised still, but not as much as he had in the past, and not as much as he would like. His social situation was really pretty good, had a supportive partner. He went to AA meetings, and he liked his job as a web developer. He meditated 3 times a week on average, and he surfed, once or twice a week. He slept, like I said before, and denied any snoring. And he used fiber as a supplement and no medications. His physical exam was really unremarkable. He looked normal, muscular, lean, and his initial labs were also normal, including immunoglobulins and thyroid and urine. So, my assessment years ago would have been just this, chronic fatigue, recurrent sinus infections, irritable bowel, and chronic intermittent urethritis and tension headaches. So this is, and would have managed with basically what's been done for him, just trying to find ways to keep them comfortable to treat the acute problems when they present, but not really looking at underlying causes that could reverse and perhaps change these conditions. So this is where the path with the functional medicine assessment diverges. And going back to the analogy of the tree, it's really about asking the question, what is at the roots of these conditions? And these conditions are at the top of the tree. So this is one of the great tools that is used in functional medicine that helps organize our thinking about what is going on and what systems may be out of balance. And it's called the timeline. If you see the section on the left, it's called antecedents. And this is the terrain in which these complaints develop. So, diseases don't develop in a vacuum. There's usually some kind of imbalance happening, and that will lead to symptoms and then disease. I mean, this is different than acute medicine, where an accident could be the trigger, and that's very clear, and we do pretty well in managing those. But this is more for chronic conditions. So antecedents to the left, and then at the top is the mediators and perpetuators, and those are things that you might be suspecting are continuing the problem or are fueling the problem. And then below that is the triggers or triggering events. Those are usually things in the patient's life that might have precipitated certain imbalances. And then below the arrow there, you write down symptoms and diagnoses as they occur, in your history. So for this patient, it looked like this. And I don't have the time to really go into my thinking of why I put different conditions and imbalances in those places, or to explain my thinking, because that would take a weekend course probably. But what I want you to focus on is just the idea that this is possible. This is a new way of thinking. So this is the number one tool. And the second one is this. It's called the matrix. And again, on the left, you see those antecedents, triggering events, and mediators. And below, you see the modifiable personal lifestyle factors that you will find in the history, and you just jot them down there. And the white part is the 7 nodes of critical physiologic function. So, for instance, energy would be energy production in cells, like mitochondrial health, for instance, or biotransformation and elimination would be detoxification ability, whether of endogenous compounds or of exogenous things. And again, it's not, we don't have enough time to go into what they are. I'm just trying to illustrate that there's a different way of thinking. And we put the mental, emotional, spiritual realm in the middle, because it does influence everything else. And if you see the lines that communicate these nodes, they all interrelate. And that's important to keep in mind. So in this patient, this is what my working sheet, of the matrix looked like. And it helped me put together an idea of what could be going on. So this leads me to the assessment. And this was my functional medicine assessment. So number 1, I thought he had a chronic dysbiosis, which is an imbalance in the gut flora, precipitated by repeated courses of antibiotics in a setting of limited maternal flora inoculation at birth, because he had a C-section. Secondly, he had food sensitivities, likely, especially to dairy, precipitated by bottle-breast combination and the above factors. And third, increased intestinal permeability, possibly precipitated by early food sensitivities, stress, heavy alcohol use, and chronic dysbiosis. And recurrent infections due to immune dysregulation, again, triggered and perpetuated by food sensitivities, dysbiosis, and increased intestinal permeability. Nutrient insufficiencies resulting from poor nutrient absorption due to gut inflammation caused by chronic dysbiosis, increased intestinal permeability, and food sensitivities. You see how repetitive it is because there's overlap. Fatigue and headaches, possibly due to compromised mitochondrial bioenergetics and or burden detoxification systems from increased burden of all the above and history of substance abuse. And lastly, the chronic urethral irritation, possibly due to a toxic irritant, whether environmental or endogenous, or a reaction to a food substance. So this is what it would look like on the visual. So those imbalances, those systems imbalanced at the roots. So that, let me just, I'm not going to go back because I don't know how to do it, but I just wanted to say that that whole analysis led me to order some functional laboratory testing, which my colleague Tracy went into in the previous talk. And again, unfortunately, there's no time to go into it, but basically the exams, the tests showed multiple food sensitivities, increased intestinal permeability, markers of malabsorption, dysbiosis with increased Candida albicans counts, multiple nutrient deficiencies, impaired detoxification, and increased oxidative stress. So it really confirmed my suspicions. And so that led to a treatment plan. And this is actually a very simple case and one of the most foundational treatment plans in functional medicine is called the 5R program. And that stands for remove, replace, reinoculate, repair, and rebalance. And so the idea is you remove what shouldn't be there. So we remove the reactive foods because they were triggering chronic inflammation. And we, with a herbal antimicrobial formula, we removed, the overgrown candida, and then replaced digestive enzymes to aid digestion, and we replaced deficient nutrients just to get a system repairing itself. And then reinoculate with probiotics that were low, repair the intestinal lining with glutamine, which nourishes intestinal cells. And we rebalance, he was already meditating 3 times a week, but we just increased it to daily. And again, the base of the pyramid of all this is a whole foods, nutrient dense diet with lots of phytonutrients and healthy fats, which he was mostly doing. So let's go through the clinical course. At 2 months, he said that his digestive symptoms had resolved almost immediately after starting the elimination diet. And the sinus congestion had resolved. He had only 2 headaches, which lasted a day and were milder. Urethral irritation was less, and he had improved energy. He was awakening refreshed after 8 hours of sleep. So at that point, we stopped the antifungal herbal formula. 2 months later, he had not had any bouts of sinusitis or headaches or abdominal complaints, but still had some urethral irritation. He had normal energy by then, and he was exercising daily, and his focus and concentration and sleep were all normal. And he said that even though he'd never felt depressed before, he was feeling much happier and lighter. So at that point, we stopped the glutamine and probiotics. And at 6 months, he said he felt completely normal and was back to his normal activities. And at that point, we started reintroducing the reactive foods one at a time on a weekly basis to see how he did. And we stopped all nutritional supplements. So a year later, he said he felt completely normal, except that he still had occasional mild urethritis and headaches that were clearly precipitated by the dietary indiscretions. Basically, it was just that he continued to have dairy and gluten sensitivities. So he mostly avoided them with occasional indulgences. And the plan was to continue that way. So basically, some take-home concepts of what functional medicine is that you look at chronic diseases as resulting from a disturbance of the balance of core physiologic processes. And the idea that these physiologic processes are interconnected in multiple ways, so you have to address the whole web at the same time. Because if you address one factor, it may be necessary to do so. For instance, if we had just given him digestive enzymes, for instance, maybe that was a necessary step, but it wasn't sufficient to affect a change. You really need to address all the different parts of what you identify as being out of balance. Or you can do it sequentially, but you need to have a picture, that web picture. And lastly, that the environment and lifestyle are major contributors to these imbalances, and you must address them. So I hope that this gives you a better understanding of what functional medicine is, and that gives you hope that that we can affect positive change in diseases that we previously thought was impossible. That now, it is possible to turn many chronic diseases around, if not cure them, at least improve them, and that affects their overall health long term. So some Monday morning applications that you could do, even with this amount of knowledge, because I didn't go into any details, but again, what I want you to take with you is that idea that the core physiologic processes exist, and that you can learn how to identify these, and that learning how they're interrelated and where you can intervene is really a game changer. But without all the detailed knowledge, you can do some things just starting on Monday. And the first thing I would suggest is that you listen carefully to a patient's story without discounting apparently irrelevant information. Now, we unfortunately have very short amount of time with our patients. And of course, this doesn't apply to anybody that comes in with a sprained ankle, for instance, but it's with patients that you've been struggling with, and that you want to set aside an extra long appointment and really see if you can delve into and get some idea about what may be going on. So some useful questions to ask them is, what life events occurred before or around the time of the onset of your symptoms? When were you last well? If you can erase 3 problems with a magic wand, what would they be? And this tells you what's important to them, because sometimes what's important to you is not really what's important to them. And what do you think caused or is contributing to your symptoms? Sometimes patients know what might be bothering them. And then see if you can create a timeline of events, diagnosis, and symptoms, even if it's just for practice, to you start seeing patterns that way. Also consider the terrain, what was going on for the person before they developed these symptoms. And consider the timing, like I said, with a timeline. And optimize lifestyle habits. That's a no-brainer. And if you can't do it in your practice because there's no time, there are health coaches that are trained to work with doctors to help support their patients making lifestyle changes. And I've included some resources at the end where you could seek one out. Or perhaps work with a naturopath. Naturopaths are trained particularly in this 5R program, for instance. And 2 important questions to ask yourself is, is there anything in this picture that needs to be removed? Whether it's a toxin, microbe, allergen, stress, a toxic person in their lives. etc.? Or is there something missing that that particular individual may need? So I hope that's helpful. These are some resources that you can seek. The Institute for Functional Medicine website has more information about functional medicine and many training courses. ACNEM, which is the Australasian College of Nutritional and Environmental Medicine, is a more local organization that has fantastic functional medicine course content as well. There's a book by Jeffrey Bland. He's one of the fathers of the founding fathers of functional medicine, and a podcast, which might be a good way to start because it's easy to listen to podcasts. And Mark Hyman is one of the best spokespeople for the functional medicine community. AIMA, Australasian Integrative Medicine Association, which also has multiple courses and educational opportunities, and this health coaches network that is local to New Zealand and Australia, who are aware of some of these concepts. So these are some references, and thank you very much.